Greetings from National Academy of Medical Sciences, India. Focusing on NAMS Vision 2030, NAMS is pleased to share some of the important activities like NAMS National, International Fellowship and Membership, Member After Day and AIIMS-NAMS, NAMS Task Forces, AIIMS-NAMS Navigate Medico CME activities, publication of annals, newsletter, networking with professionals, public orations, Young Scientist Fellowship, Scientist Exchange Program, scientific visit of Emeritus Professor and many more activities. All application forms for fellowship, membership, associate fellowship, and member after day NB have been made online and objective criteria from the year 2022. AIIMS has also started a new online AIIMS-NAMS Navigate CME and Navigate Medico CME program to assist in the development of competencies among PG students and share multimedia learning resource materials as e-library. NAMS has also started 21 task forces to address medical issues of national importance. Greetings from National Academy of Medical Sciences, India. Focusing on NAMS Vision 2030, NAMS is pleased to share some of the important activities like NAMS National, International Fellowship and Membership, Member After Day and AIIMS-NAMS, NAMS Task Forces, AIIMS-NAMS Navigate Medico CME activities, publication of annals, newsletter, networking with professionals, public orations, Young Scientist Fellowship, Scientist Exchange Program, scientific visit of Emeritus Professor and many more activities. All application forms for fellowship, membership, associate fellowship, and member after day NB have been made online and objective criteria from the year 2022. AIIMS has also started a new online AIIMS-NAMS Navigate CME and Navigate Medico CME program to assist in the development of competencies among PG students and share multimedia learning resource materials as e-library. NAMS has also started 21 task forces to address medical issues of national importance. Under publication activities, NAMS has its own annal as Annal of the National Academy of Medical Sciences. In addition, NAMS also publishes its quarterly NAMS newsletter. For more details of NAMS activities, please visit our NAMS website www.nams-india.in or scan QR codes with the camera app.
Greetings from National Academy of Medical Sciences, India. NAMS has been recognized by the Government of India as a nodal agency for promoting the continuing medical education for medical and biomedical professionals. National Academy of Medical Sciences encourages and sponsors nationwide CME programs, symposia and workshops in medical and biomedical professionals. NAMS is pleased to announce the launching of a joint AIIMS-NAMS Navigate CME program from 1st September 2023 for postgraduate students in all the AIIMS and other eminent institutes of national importance from Andhra Pradesh, Arunachal Pradesh, Assam, Bihar, Chhattisgarh, Goa, Gujarat, Haryana, Himachal Pradesh, Jammu and Kashmir, Jharkhand, Karnataka, Kerala, Madhya Pradesh, Maharashtra, Manipur, Meghalaya, Mizoram, Nagaland, Odisha, Punjab, Rajasthan, Sikkim, Tamil Nadu, Telangana, Tripura, Uttar Pradesh and Uttarakhand of the country. The program is being conducted online on the first Friday of every month from 3 p.m. to 5 p.m. The AIIMS-NAMS CME focuses on the topics which are of common interest for the postgraduates across all specialties. The aim of the National Virtual Postgraduate Medical CME is to help them to be more proficient in their profession. Each session will cover 2 topics. Each topic will be of 1 hour duration, which includes 45 minutes for presentation by speaker, 15 minutes for questions and answers. Thank you for your kind support.
Hello and good afternoon, everyone. Welcome to the next session of joint AIIMS-NAMS Navigates Medico CME program for the postgraduates. So today we have 3 extremely relevant topics to the clinical practices and day-to-day life of a medico. And these all 3 topics would be presented by 3 speakers. So to continue with the session, first of all, I would like to welcome Professor Shiv Kumar Sharin. Sir is president of National Academy of Medical Sciences, and he is director of senior professor hepatology and director of Institute of Liver and Biliary Sciences. He is director WHO Center on Chronic Liver Disease and Viral Hepatitis at ILBS. He is adjunct faculty of molecular medicine at JNU. He has been bestowed with Padam Bhushan by the government of India.
One you can
He,
skip. Let's move for the.
sir,
Okay,
so
thank you.
yes, sir.
Go
So
ahead.
we seek your blessings to initiate
you.
the session. Thank you, sir. Over to you, sir, please.
Thank you, Jaswant. And I normally, Dr. Kapil also helps us in the program, our secretary of the NAMS, and Preeti, who has helped. The AIIMS-NAMS together have committed to provide best of class learning lessons to students who we want to navigate and get into the super specialty or even at higher positions. And we are privileged that the NAMS, AIMS, CMEs have become a big popular thing. I do hope every month students across the country can join. And this year, this is the third in this session, and we are going to conduct it every month. Please give your feedback. And today we have some excellent speakers, and I would like, I'm not sure Dr. Srinivas, the director AIMS, has joined, but somewhere his spirit and mind is with us. And we are lucky today to have Professor Farhanul Huda, who is going to speak on the breast and endocrine areas. And we also would like him to communicate on healthcare and how I look after the healthcare in the country. We also would have today Dr. Vandana Dhingra. She is likely to cover the area of transfusion medicine. And we would have Dr. Geeta Negi. She will be also part of our program. I think Vandana would be speaking on self-confidence in healthcare workers and Dr. Geeta Negi on transfusion. What is unique about NAMS is that it will allow each of the medical student who has passed his MD, MS to become a associate member. Associate member of National Academy is a feather. Like NBE, National Board, you become a MNA, MS. Here you will become an associate member. If you had done DM, MCH and have 3 years experience, you can become an associate fellow and subsequently a full member or a full fellow. Why should I join NAMS? Because it covers all branches. If I say work on liver, I go and attend only liver conferences. So I forget, I have a tubular vision. But by joining NAMS, you will have a lateral thinking and you will grow into a better physician, a better surgeon, a better administrator. So with that in mind, I thank all the 3 speakers today for joining us, and thanks Jaswant and Preeti and Dr. Umesh and Dr. Sood to make this happen, and Dr. Srinivas. Please proceed. Thank you.
Thank you, sir. Thank you very much for your blessings and kind words. In order to continue the session, I would like to welcome Professor Umesh Kapil for his kind words and to welcome the audience and speakers. Sir, please.
Yeah, namaskar and good afternoon to all of you. It's on behalf of National Academy of Medical Sciences. It's a proud privilege to welcome all of you, particularly all the participants who have joined us in AIIMS-NAMS Navigate program. It's a very humble effort of National Academy of Medical Sciences to reach to the maximum number of medical postgraduates in different parts of the country. through this medium, we are able to reach the remotest corner of the country. We have people from Tripura, Meghalaya, Odisha, all the places in the country who have just joined us. It's a really something which we are able to connect the most different people, medical scientists as a faculty, with the postgraduate students. But this is our humble effort, and we are trying our best to have the best of the best medical faculty who can undertake this activity. Now, what we have done is that these presentations are helpful in the routine practice of the postgraduates, which they feel, which any specialty they might be, but these skills are important in their routine practice. Now, apart from this, what is important is all these lectures which have been done online are also available on the YouTube. And we also try, no, we not try, we always upload these lectures on our NAMS website, which is a virtual library of about 70 lectures till date. And any postgraduate who wants to visit these lectures again, presentations again, he can get benefit of these lectures. Plus, all the PowerPoints are also uploaded so that they are able to access the PowerPoint presentation also. With these few, my most welcome to all the participants, all the speakers, very kindly accepted our request to be a resource faculty for these NAMS, AIIMS, Navigate program. Thank you very much. Over to you, Dr. Jaswal.
Thank you, sir. So, thank you, sir. Thank you for the warm welcome to all the speakers and the participants. So, continuing with the session, now we would like to present a message from Professor M. Srinivas, Director, All India Institute of Medical Sciences, New Delhi. We would like to, sir has sent us a message. Due to his unavailability, he couldn't be on the online, but he has left a message for all of us. Yeah, so we are just presenting a message from Professor M. Srinivas.
Namaskar. At the outset, I congratulate the team behind the AIIMS-NAMS CME program. Providing quality of education to our postgraduate students is one of the prime responsibilities of AIIMS. I know that our able faculty is leaving no stone unturned in achieving this mission. However, there always remains a scope for improvement. Through this unique initiative, there is an opportunity for our postgraduate students to learn from the experts in their field. This learning will go beyond the boundaries of department where our postgraduate students are working and will also bring in more flavor in their knowledge and at the same time ensure dissemination of uniform, high-quality content all across the nation. Postgraduate students also form our primary workforce for providing patient care. This indeed is an important component of their training. We are aware that our postgraduate students devote a large component of their time for the patient care services and thus they have less time for self-study by the end of the day. The timing of this activity is therefore very carefully chosen. The sessions will be held late in the afternoon so that the beneficiaries do not have to make any extra effort for attending them. This by itself exudes the philosophy of a true teacher, a mentor that will handhold the children through the process of their active learning. As the sessions are online, which by its very design is a non-synchronous platform, it may seem that the delivery of the content will be one-sided, but enough measures have been planned and they are in place to make the activity as interactive as possible. The topic of the session will be shared with the students well in advance. This will allow them enough time to explore the subject and be better prepared to absorb the content. This design, therefore, also matches the concept and principles of adult learning. The program not only will help our postgraduate students in being better prepared for their examinations, but also will equip them with sufficient knowledge, understanding, and approach to be a better professional in their field. I wish this program all success. Thank you.
So thank you everyone. Proceeding with the session, the first topic of today's session is very important in our day-to-day healthcare delivery system and communication in healthcare. Why should I care? So this session is by Dr. Farhanul Huda. He is currently additional professor and program coordinator. He is MCH in breast and endocrine surgery. He is associate dean research at AIIMS Rishikesh. He has interests in breast surgery, oncoplastic breast surgery, simulation-based medical education, wound healing, and tissue repair. He has more than 75 journal publications, 9 chapters in books, more than 50 presentations in national and international conferences. He has numerous award and certificate courses in medical education, Dundee University at U 2022. He has been awarded with Asian Education Best Professor of the Year Award 2021, Best Teacher Award 2019, more than 10 best papers and poster awards in various scientific meets. So here we go with the presentation from Dr. Farhanul Huda on a very important, very relevant, extremely relevant topic, that is communication in healthcare. So here we go for the session.
Hello everyone, I'm Dr. Farhanul Huda from AIIMS Rishikesh, and I'll be talking today about communication in clinical practice. The learning objectives of my talk are: we'll come to know what is communication, why communication in healthcare is important, and what are the different ways of healthcare communication. Now, communication has been derived from the Latin word communicare, meaning to have something in common. There are various ways of exchanging information: speaking, as I'm speaking with you today, then writing, then there are different signs, and behavior, which is known as the non-verbal language and communication. Now let us see why communication is so important in healthcare. Because we are dealing with complex information, we are dealing with complex illnesses, which requires coordination with a multidisciplinary team. There are increased patient expectations and limited resources. And the most important thing is the culture of complaints and litigation. Now, doctors are perceived as people having knowledge. Patients have perception that they have power. They are dealing with health issues. They have responsibilities, and they usually belong to the middle class. Whereas if we see the patients, they have different beliefs. They are vulnerable. They are frightened and anxious. They are definitely suffering. They have their own rights, and they belong to any class. Now, you can see there is a gap between doctors and patients, and communication is the bridge between this gap. Good communication depends on good clinical experience, knowing your patient as well as your subject, command on the language where you are practicing, good articulation skills, demonstrating and responding to verbal and non-verbal cues, giving time to the patient, and empathy, putting yourself in the shoes of the patient. Now, there was a research which was done on what are those doctors whom the patients prefer. And it was found that doctors who introduced themselves, who were sympathetic, who appeared confident, who listened to them, who explained the process in simple language, asked precise and simple questions which were comprehensible and understandable to the patient and did not repeat themselves were preferred over others. The art of listening is a very important part of communication, and throughout my talk, I will be emphasizing on active listening. Now, what is active listening? How can we achieve active listening? By making eye contact, by paraphrasing, not interrupting the patient at all. The art of silence, keeping silent, is a very important tactic of good communication skills. Looking for the non-verbal behavior of the patient, wincing, grimacing, anxiety, all these are the non-verbal cues which you have to pick up while you are communicating with your patient. Giving feedback as well as verbal as well as non-verbal. Non-verbal feedback in the form of smiling, leaning in, and mirroring. Reflect back what is said. Be non-judgmental with the patients. Feel free to ask questions which again have to be simple and understandable. You should always ask for any clarification which you think you might want from the patient. And at the end of the communication episode, event, always summarize so that it becomes clear to the patient that you have understood his problem. Now, if you can see the time to interruption, again, I'm talking about active listening and being silent so very often. So the time to interruption in primary care was just 22 seconds, but in secondary care, it increased to 92 seconds. Now, let us see what are the barriers to communication. If we are not well versed with the knowledge of our subject or about the disease, then definitely we cannot communicate very well with the patient. Interpersonal skills barrier, like I'm not communicating properly with my teammates, with my juniors, with my seniors, with my nursing officers. Then time barrier, because I'm tired, I'm too much stressed, there's too much of work pressure. All these things lead to poor communication. Language barrier, which we usually see in our residents, in our patients sometimes. And there's some problem in the personality. People are introvert, people don't communicate properly inherently, or there is a social class which leads to ineffective communication. Let us see the benefits of communication. It has been seen with good communicating skills, with good communication, the problems are identified more accurately. There is adherence to treatment instructions by the patients. There is better emotional health, which leads to effective symptom resolution and pain control. And definitely a good communication can likely reduce the incidence of clinical errors. What does the evidence say? Asking patients to repeat their own words increased retention by 30%. And this is what we do when we are doing a closed loop communication. Patients who are viewed as partners and informed of treatment rationales are found more adherent to treatment. The most important factor in compliance to treatment is good communication. Marvel said that the longer a doctor waits before interrupting a patient, the more likely are the chances to discover the full spread of issues. So again, I would emphasize the art of listening. And picking up and responding to the patient cues shortens rather than lengthens the visit. So you have to pick up and you have to respond to the patient's issues, patient's problems. This is the basic frame which is proposed by the MD Anderson, the class protocol, the key steps for clinical interviews. C for context, that is the physical setup of the area you choose for the interview. Your listening skills, how effective a listener you are. Acknowledge how to validate, explore, and address emotions and concerns and their expectations as well. The strategy, how to provide a management plan that the patient can understand, and summarize, how to summarize and clarify the conversation, ensuring comprehension, ensuring that the patient has understood everything. Now, in 1999 came the Kalamazoo Consensus Statement Assessment Tools, which is a checklist, which is adapted by most of the centers, and the gap is fulfilled by the Kalamazoo Communication Skills Assessment Form, which is the versions are the clinician version, the faculty version, the patient or the family version, the peer communication skills assessment form, which is the versions are the clinician version, the faculty version, the patient or the family version, the peer facilitator, and the self-assessment version also. So how do you start doing that now? The simple question is, what brings you here? How can I help you? What can I do for you? And tell me your concerns. So you can start your communication, your interview with your patient encounter with these simple questions. Then rapport building, which is a continuous process which starts the moment the patient is maintaining privacy, avoiding distraction. The most common distraction nowadays is our mobile phones. Giving reassurance to the patient, and again, active listening. A good listener is always a good communicator. And then certain non-verbal or body language behaviors like keeping a good eye contact with the patient while you are talking to them, less and less of interruptions, address their ideas, their concerns, their expectations. Expectations also have to be addressed because sometimes the patients do have certain unrealistic expectations. And the most important part of non-verbal behavior is your body language. How are you sitting? What is your posture? Whether it is an open posture or a forward posture or a closed posture, which we'll learn in the subsequent slides. Body language and non-verbal behavior, we look what is the sitting arrangement, how can you touch the patient, you can shake hands, you can touch gently the forearm, the elbow, or the forehead. What is your body language, whether it is open or closed? What emphasis by body parts, which coincides with the verbal cues. It means gesticulating to help communicate with your patients, and the eye level and the eye contact, whether it has to be higher or lower. The eye level should be at the same with the patient. So this is the sitting arrangement. It could be adjacent, it could be at the cross, but preferably it has to be adjacent. Once you ask your patient to sit adjacent to you, the patient feels that both of you, the patient and yourself, are going to solve the problem together. And across is more formal way of dealing with problems. Similarly, if you can see on in this photograph down, you can see that if the healthcare personnel and the patient are at the same eye level, then the communication becomes more effective. Now, the touch again has to be correct and appropriate. A pat on the shoulder, touching the forearm, a handshake, or touching the dorsum of the hand. All these touches are correct and appropriate, and it helps for non-verbal communication. So these are the different body language postures, the open and the closed. Open posture means that they are open to ideas, they have an open attitude, and they are open to whatever the concerns, the ideas, and the expectations the patient has. Whereas a closed posture means that they are defensive or they have a negative attitude. So always try to keep your posture open as well as sitting up straight, because that sends a message that you are confident and you have some credibility. Then again, gesticulating again helps a lot, gesticulating by your hands or simply making diagrams and helping the patient to understand. Then let us come to the verbal behavior or your style of talking. How do you talk? What do you talk? The most important thing is whether you are asking an open-ended or a closed-ended questions. And before asking personal issues, for example, the sexual interactions, apologizing first that please don't mind if I ask something about your sexual encounters. Then active listening again, and then giving your reflective comments, staying on the topic and not deviating from it. If there are any interruptions which you have to take, there is a call from the emergency, or there's a resident peeping inside your OPD room, then you have to apologize from the patient and then you can carry on. You should never express any kind of anger or raise your voice while you are communicating with the patient. Always respect the patient's culture and beliefs. And you have to always use simple, non-medical language which the patient understands. So to summarize, communication is the essence of patient-centered care. A good physician is a good communicator. Good communication increases acceptance and builds trust, and good communication increases acceptance and builds trust. So what is cure? A close friend of yours visits you after 10 years. You are happy to see him. You go to a well-known restaurant to dine with your friend and order for a favorite dish. But when the food arrives, after having the first bite, you do not like it. There is another good restaurant across the street. What will you do now? In the end, you should be happy. If you are not happy, then it is not the end. In the end, the patient should be happy. If the patient is not happy, then it is not the end. Good communication adds to the happiness of the patient, and she believes that she will be cured. Honesty of thought, honesty of speech, and honesty of action. This is what we have to inculcate in ourselves. Thank you so much.
So that was a very important session and very relevant topic in today's practice. We thank you, Farhanul Huda sir. So, continuing the session, we welcome our next speaker with another very important topic, that is self confidence in healthcare workers and empathic healthcare worker. So, this presentation would be done by Dr. Vandana Dhingra. Ma'am is additional professor in the Department of Nuclear Medicine at AIIMS Rishikesh at Uttarakhand. Ma'am developed nuclear medicine facility in the state of Uttarakhand. She has more than 35 research publications in peer-reviewed journals and has participated in various national and international conferences over the past 12 years. See, ma'am has more experience and the interest in conventional nuclear medicine and nuclear cardiology. She has been a principal investigator in various research projects at institutional level, at collaborative research with the DRDO and IIT Roorkee. She has been mentored various PhD and MD students and is presently a guide and co-guide for MD, PhD and MCH students at AIIMS Rishikesh. She has presented various papers and delivered lectures at national and international workshops and seminars. She enjoys writing and music among other extracurricular interests. So I welcome ma'am. Dr. Vandana ma'am is with us. So now it's over to ma'am to for the next very important session, that is self confidence in healthcare workers. Ma'am is with us. We all can ask ma'am questions in the end after completion of this session.
A very good morning to all dear students. I am Dr. Vandana Kumar Dhingra, Additional Professor in Department of Nuclear Medicine at AIIMS Rishikesh. Today we will be talking about something which is useful for all the future healthcare workers like you students, and also for all students and trainees who are undergoing the post-graduation training. So we will be talking about empathy in healthcare, and we will talk about how you can be an empathic healthcare worker. So if you see this photograph, there is a message. If you see carefully, you will see that there is a patient on the left and the doctor or the healthcare worker on the right. Now what you can observe is that they both are smiling, and if you see the body language, the doctor is keeping a right hand on the shoulder of the patient. So she is providing additional. A very good morning to all dear students. I am Dr. Vandana Kumar Dhingra, Additional Professor in Department of Nuclear Medicine at AIIMS Rishikesh. Today we will be talking about empathy in healthcare, and we will talk about how you can be an empathic you students, and also for all students and trainees who are undergoing the post-graduation training. So we will be talking about empathy in healthcare, and we will talk about how you can be an empathic healthcare worker. So if you see this photograph, there is a message. If you see carefully, you will see that there is a patient on the left and the doctor on the right. Now what you can observe is that they both are smiling, and if you see the body language, the doctor is keeping a right hand on the shoulder of the patient. A very good morning to all dear students. I am Dr. Vandana Kumar Dhingra, Additional Professor in Department of Nuclear Medicine at AIIMS Rishikesh. Today we will be talking about A very good morning to all dear students. I am Dr. Vandana Kumar Dhingra, Additional Professor in Department of Nuclear Medicine at AIIMS Rishikesh. Today we will be talking about something which is useful for a touch in addition to whatever she also for all students and trainees who are undergoing the post-graduation training. So we will be talking something which is useful for all the future healthcare workers like you students. So if you see this photograph, there is a message. If you see carefully, you will see that there is a patient on the left and the doctor or the healthcare worker on the right. Now, what you can observe is that they both are smiling, and if you see the body language, the doctor is keeping a right hand on the shoulder of the patient. So she is providing a touch in addition to whatever she is talking to the patient, and this has led to the patient to smile. So this photograph is a typical example of how an empathic or an empathy filled professional healthcare professional can appear. In this cartoon also you see a similar picture. You see that the doctor, the healthcare worker, has his hand on the shoulder of the patient, but the scenario is a little different. If you see that the eyes of the patient are quite prominent and the patient appears to be in distress, so obviously he is in some kind of pain. And if you see the quote, it says, "I feel your pain." So the hand of the doctor is on the patient's shoulder and he's expressing his care or his concern for the patient in the form of words as well. If you think of a scenario, you are in a clinic and an older woman comes complaining of knee pain. She has arthritis in both the knees. So there are many practical solutions you can her situation in your tone and words, like how a very good morning to all dear students. I am Dr. Vandana like you students, and also for all students and trainees who are undergoing the post-graduation training. So we will be a very good morning to all dear students. I am Dr. Vandana Kumar Dhingra, Additional Professor in Department of Nuclear Medicine at AIIMS Rishikesh. Today we will be talking about something which is useful for all the future healthcare workers like you students, and also for and communicate and act. Just mere empathy refers to the ability to identify and understand emotions of the other. A very good morning to all dear students. I am Dr. Vandana Kumar Dhingra, Additional Professor in Department of Nuclear Medicine at AIIMS Rishikesh. Today we will be talking about something which is useful for all the future healthcare workers like you students, and also for all students and trainees who are undergoing the post-graduation training. So we will be talking about empathy in healthcare, and we will talk about how you can be an empathic healthcare worker. So if you see this photograph, there is a message. If you see carefully, you will see that there is a patient on the left and the doctor or the healthcare worker on the right. Now what you can observe is that they both are smiling, and if you see the body language, the doctor is keeping a right hand on the shoulder of the patient. So she is providing a touch in addition to whatever she is talking to the patient, and this has led to the patient to smile. So this photograph is a typical example of how an empathic or an empathy filled professional, healthcare professional can appear. In this cartoon also you see a similar picture. You see that the doctor, the healthcare worker, has his hand on the shoulder of the patient, but the scenario is a little different. If you see that the eyes of the patient are quite prominent, and the patient appears to be in distress, so obviously he is in some kind of pain. And if you see the quote, it says, "I feel your pain." So the hand of the doctor is on the patient's shoulder, and he's expressing his care or his concern for the patient in the form of words as well. So if you think of a scenario, you are in a clinic and an older woman comes complaining of knee pain. She has arthritis in both the knees. So there are many practical solutions you can offer to help, but you also choose to show empathy. You can do this by reflecting her situation in your tone and words, like how I just showed you in the previous images. You can say things like, "I know it must be really difficult to go about your normal life with this pain. Let's see what we can do to help." And the other way to go about this is कि क्या हो रहा है ना, दवा लिख देते हैं, इसका तो कुछ नहीं हो सकता. So these kind of words are also words which we can use for these patients. Sometimes we do use such words. So we must say कि we understand your pain. This is important to express, and also to say that let's see what we can do to help. You may be seeing 50 patients of similar kind in a day, but for that patient you are the only person whom he can complain to, or who can express his pain. So you have to show to him that you understand his pain, and you will do your best to help him. So what exactly is empathy? Empathy actually would mean that you understand the other person's position or his difficulty. And there are three basic kinds of empathy which have been seen, that is affective, somatic, and cognitive. So affective empathy means that you are responding to the other person's emotions appropriately. For example, if he's being sad, or if he's expressing his pain, you have to respond in a very sensitive manner. You cannot be harsh, or you cannot be impersonal with that patient. You have to show some kind of a sensitive response. The other thing is somatic empathy, in which it shows the ability to feel what another person is feeling. So this is a bit more deeper, where you are actually feeling what he is feeling, and then you express what you actually feel. The third one is the cognitive empathy, which is the ability to understand someone's response to a situation. That is, if he responds in a particular way, you understand that. So what is the exact definition of empathy? It is the ability to put yourself into somebody else's shoes or to feel their pain. As a multidimensional phenomena, empathy incorporates affective, cognitive, behavioral, and moral components. So researchers have identified the two types, affective and cognitive. So as we also discussed in the previous slide, affective empathy are sensations and feelings in response to the other person's emotions. And cognitive empathy refers to the ability to identify and understand emotions of the others. Now, empathic people can identify and understand situations, feelings, motives, and perspectives. Moreover, recognize and appreciate the concerns of another person. So, a person standing in front of you is simply not that moment. He has traveled, he has come from his home. So, when you are empathic, you imagine that what kind of home he must be living in what way he must have traveled to this place, the bus, the public transport, or his car, what are his situation or conditions at his home, what kind of a house he's living in. So when you see that person, you actually imagine all that and you look at him in that way. So that is what an empathic person would be doing. Now this cultivates curiosity about strangers, challenge prejudice, and discover commonalities. Try another person's life, listen, open up, inspire mass action and social change, and develop an ambitious imagination. So now this sentence is quite complicated and it is from literature, but what exactly I mean to say is that when you look at a patient, you look at his entire social milieu, his family, and from where he comes. So this in when you think in that way, you are interested in knowing more about the patient. When he tells you about his pain, you also ask him automatically, okay, when this pain is more. So he can tell you that, okay, when I do this, if he suppose he's a tailor, or if he's if he's a laborer, you can imagine obviously his pain would be more in the evening after he has finished his day's work. So when you are understanding the patient in the holistic way or from his perspective, then automatically these queries will creep up. And when you ask him these questions, or when you are interested in knowing these things, the patient will be more comfortable and you will be an empathic person or an empathic worker. So empathy in patient care is very essential to provide patient-centered care, and is described as the ability to understand the patient's situation, perspectives, and feelings, communicate that understanding and check its accuracy, and then act on that understanding with the patient. So suppose there is a patient who has tuberculosis and he has to undergo treatment for about 9 months or 1 year. You have to understand his routine or the kind of life he's leading in order to make that treatment effective, or in order to ensure that he is complying. So subconsciously and unconsciously, as you become more and more experienced, these things will develop in your profession. But when you're aware of it at an early age, or even during your training, it will lead to a much better professional behavior, and you will be much more successful and much more popular with your patients. So three action words like understand, communicate, and act. Just mere understanding is not enough. You may think about that patient or whatever I said, but if you do not communicate it, or if you do not act accordingly, then it is an incomplete task. So these are the foundations for effective and high quality therapeutic relationship with the patient. You understand, you communicate it, that yes, I know that you have this, or I know and we will do, and also act. If you tell the patient that you please come next week at 11 o'clock, you must meet him at that time as well, or try to communicate to him if you're not able to be there at that time. So acting up is also very important. The correlation between empathy of healthcare workers and improved patient adherence, satisfaction, and treatment outcomes is well established. So once you do the above three, this row of a positive outcome is very much likely, and it has been shown and it has been proved scientifically as well. Professional satisfaction of healthcare providers is also correlated. Now, when the patient is satisfied, the patient comes back, and the treatment outcome is positive, it provides professional satisfaction to you as well, and you also grow. So this is a very nice and beautiful continued cycle which goes on. So effective delivery of compassionate and collaborative patient-centered care requires empathy-based skills and should be routinely and deliberately taught, modeled, and assessed across continuum of healthcare curricula. So your teachers and your professors, and when you even observe them working directly or indirectly, you will pick up a lot of empathy-based skills in an informal way on the routine practice. But even in the curriculum, this needs to be added, and it is there in many colleges and schools, and it's very important to include it in the curriculum as a part of the curriculum and even in assessment. So competencies in affective skills are included in accreditation standards as required curricular outcomes. The Association of Medical Colleges, American Medical Colleges, have included empathy as an essential learning objective for medical education. Now, empathy and professionalism. Empathy has shown to play a very positive role in the development of interprofessional collaborative practice and attitude towards interprofessional collaboration. Now, what does this mean? So, when you are empathic and when you have an empathy based professional career or life, you will also be positive in collaborating with others, for example, your colleagues, or doing more studies with other patients or with other institutions. So even over there, this empathic approach will play a very positive role, because empathic professionals communicate and listen more reflectively. Empathy has shown to have a positive impact on the ability to recognize social determinants and disparities in healthcare and reduce prejudice. So once you have an empathic background, you will be able to understand the problems which the patients are facing or which the healthcare system has. And this will help you to tailor your studies or to tailor your research or collaboration with other people in your professional career. And that is how it will help you. Poor cognitive empathy was correlated with deficiencies in self-awareness of emotional states. Empathy is considered an integral part of professionalism along with knowledge, humanism, and competence. So it is one of the spokes in your professional career that knowledge and competence has to be accompanied with empathy, especially in healthcare, because you're dealing with human beings. Leaders with empathy were shown to thoughtfully consider feelings of others and increase use of teams, excel in cross-cultural communications, and demonstrate ability for creating and achieving shared goals. So when you are an empathic healthcare worker, you will also be a very good leader and you will excel in all kinds of spheres of your career. So nobody cares how much you know until they know how much you care. So this is what Theodore Roosevelt said, and this holds true even today and will always hold true. So what are the methods to enhance empathy? So we've spoken a lot about being empathic and trying to be better in your profession, but how do you do that? So it can be enhanced by strategic educational interventions. Training on development of communication skills has shown to result in significant increase in empathy scores. Integration of live experience interviews significantly increased empathy towards vulnerable groups of patients. Empathy was promoted by use of video recordings of patient stories, serviced to underserved communities, and reflective writing. You must have seen that certain advertisements of UNICEF and UN and these kind of organizations, they'd always start with a video or with a real interview of some patient who is undergoing some kind of distress, or you see a hungry child in the African subcontinent who is starving, when you have the so these kind of videos or interviews or visualizing a real person makes a lot of difference, because you actually start to feel for that rather than a text or a sentence, and then you can develop the empathy. So these are actually proven methods of increasing empathy towards your patients. To advance empathy in medical students, 5 approaches have been shown to be effective. Early clinical exposure, that is direct patient contact or simulated patient. Direct is always better. Playing a role of a patient in your class with One of you becomes a patient and one of you becomes the physician, and you do a role play. Exposure to literary and performing arts, improving communication, narrative and stress management skills, exposure to role models. So you can have a person or a very experienced physician who may come and speak to you. That is your exposure to role models. They may give you their own experiences. You may have workshops which involve role playing. A scenario may be given to you and then you may enact that out. There may be multiple teams. That is what usually is done in medical humanities workshops, and we do have them in many medical colleges now. Then there are stress management skills, because stress can lead to loss of empathy, and when you are not stressed, you are automatically more empathic. Improving communication, so you may have techniques or narrations or speaking out, or even simply reciting a poem that may make you improve yourself in communication skills, and that again can play an important role in improving your empathy. Role modeling by clinical instructors during experiential training was also reported as one of the most important influence in empathy education. So these are the things which you should be aware of, and practically they may be experienced, or you may undergo workshops or classes in actual experiences. Significant improvement in empathy resulted from exposure to a 3D simulation of culturally and linguistically diverse patients in a hospital setting, and simulation of medical consultation with standardized patients. So that's another way of doing this, because if you are in another country, or if you are exposed to a patient who is from another country, you may have very different have a different behavior with these patients. So again, simulation and understanding a scenario where you are exposed to such foreign patients or in a foreign environment would lead to a better skill and development. Other educational strategies used to enhance empathy include writing and problem-based learning, patient interviews, interprofessional education, and experiential training. These strategies have been shown to be effective in maintaining and enhancing the empathy. So now empathy is a catalyst, okay, to your overall professionalism. The positive correlation between empathy and affective skill suggests that in absence of empathy, students may not be able to effectively acquire, develop, and display affective behaviors, abilities, and attitudes. Affective behavior means that what the patient is experiencing, you are actually responding to that in a positive and in a proper way. That is affect. So empathy plays the role of a catalyst for the process of these skills to be developed and to be posed on to the patients. The catalytic properties of empathy enable and facilitate reaction, resulting in affective domain products. So suppose there is a patient who's being a little resistant and he's not ready to come for the surgery on a particular day. So suppose you talk to the patient in a positive way, or in a way that he understands and he realizes that you are thinking good for him, he may agree to do that. So that is how the empathy will improve or allow you to enhance your outcomes and affective skills. Empathy catalyzed formation of affective skills is essential to students' personal and professional development and readiness for empathic patient-centered care. For example, in a trial that tested patient benefits of enhanced practitioner empathy, there was a study by Little et al. They take sufficient time to understand the patient's history, that is, talk about general topics, offer encouragement, give verbal signs that the patient has been understood, be physically engaging in the form of hand gestures, eye contact, appropriate touch, and forward lean, warm up throughout the consultation, being professional but supportive at the beginning and warming up by the end. If you are talking to a patient and you are constantly looking at your phone or taking calls in between, that sends a very negative signal to the patient, and the patient may not even be interested to talk to you. So be careful about these soft signs and be physically engaging, like be close to the patient. You can sit up and you can ask the patient to move closer to you. So these are the kind of physically engaging techniques where you can be more effective with the same sentence or with the same kind of treatment that you're offering. So the balance of empathy. Now this slide I purposely brought in because when we keep on talking about empathy and talking good for the patient, there are certain instances in the world and in our country also where there is violence against the doctors. So you have to understand that there is a very fine line between being empathic and effectively communicative and being overly soft or overly nice with a patient. And violence is there and it exists and it does occur against doctors. So you have to understand this balance and maintain your professionalism and protect yourself from these kind of situations by being by safeguarding yourself. So in Tuticorin, there was a lady doctor who was killed by the husband, and it happens very commonly by the husband of a pregnant woman who was admitted in a serious condition. She was referred to another hospital, but she died before she could be shifted. The husband entered the consultation chamber with three accomplices and attacked her with a sword. So you must be aware of these situations, and they can occur, and be prepared for them and handle them effectively. In Punjab in 2014 in Mansar district, a doctor's clinic was burnt, and we do hear certain news clippings and videos nearly once a week happening all over our country. So these do exist. So please keep these in mind as well. The new paradigm celebrating the therapeutic effects of empathy. In this new paradigm, the heart of the consultation is the human relationship, and the following are fundamental. Empathic patient-practitioner communication is understood to be an effective intervention in its own right, so it has its parallel effects. And empathic consultation is central to evidence-based practice. So now the evidence-based practice does involve patient involvement, patient involvement in decision making, and we have to include it. Clinical acumen and skill is used not just to discover symptoms and signs, but on a par in clinical importance with interventions. Patients' views and experiences are valued as part of shared decision-making process. The days are over where you just say one sentence to the patient, okay, now we have to operate you or we have to give you chemo. You have to take the patient's views and you have to take a consent from the patient towards your strategy, towards your therapeutic strategy. Patients and carers' capacity to access, understand, and use health information is supported. Experience data are routinely collected and acted on both individual and system levels. Staff use empathy in their interactions with each other and believe that the system is concerned with their health and welfare. So the key messages that we would like to understand in this discussion today: the evidence for patient health and practitioner well-being benefits of empathy has become abundant and they cannot be ignored. While there is evidence that many healthcare practitioners do not express empathy in a way patients understand, practitioners do not usually lack empathy. Instead, they are forced to practice within a system that values targets over people. They are overloaded with paperwork and they are not given the opportunity to express their inherent empathy. So you may be empathic, but you may not be able to express it. You may not have the time. So this is a very important setback which the practitioners face, especially in developing countries. Practitioners alone cannot be the sole targets of attempts to enhance empathy. Instead, a culture of empathy must be embedded and valued within all relationships between patients, practitioners, and healthcare managers. Adding another checklist, guideline, or extensive practitioner training program will do more to increase practitioner stress and burnout rather than improve empathy. So this has to be actually ingrained or inbuilt within you. And if you do it at the stage of training, it's better. Keeping it as a chore, as a checklist, part of a checklist, whether this was done or not, becomes more and more demanding, and it will never give you the expected results. Digital technologies must be exploited to do tasks that do not require humans, freeing up the consultation to focus on human relationships. So the consultation should not involve just ticking some things and asking impersonal questions. That can be done by computers or by the patient himself, on a screen. So you must use your consultation time to interact with the patients on a more human level. Empathy does not necessarily require more time because these skills can be embedded within rather than added onto existing training and practice. So just a moment, of saying hello to the patient or saying that you're looking good today, you're looking more happy, you're looking more healthy is enough, and that just requires 1 or 2 seconds. The purpose of human life is to serve and show compassion and the will to help others. So this is what I would like to end my talk with. And this was spoken by Albert Schweitzer in his he was a medical missionary who won the Nobel Prize for Peace and Humanitarian Work in 1952. Thank you very much.
It's a very nice presentation by Dr. Vandana Dhingra, ma'am. Ma'am presented, ma'am made the slides which are very relevant and we enriched the knowledge of all the participants. So, continuing the session and coming to the last topic, but again, very important topic, that is interpersonal skills video. So, these would be presented by Dr. Geeta Negi. This is again, I would say that this is a very, very important topic. We from would like to apologize from all of you for the technical glitches that we had to face in between. So I would like to introduce Dr. Geeta Negi. Ma'am, she is professor. She is head of the Department of Transfusion Medicine and Blood Bank at AIIMS Rishikesh. She is also chairperson of mentorship and undergraduate research program. She is co-chairperson of Medical Humanities Unit. Ma'am did her MBBS in 1989 from King George Medical College, Lucknow, and MD from the same college. And later on, ma'am had a FAMER fellowship in 2014. Ma'am has a fellowship in transfusion medicine, Asian Association of Transfusion Medicine at National Blood Transfusion Center, Colombo, November 2016. Ma'am has postgraduate certification in medical education from University of Dundee, Scotland. Ma'am is NABH blood bank assessor. She has various interests in regenerative medicine, FRSs, quality management system, medical education, medical humanities. Ma'am has established advanced blood transfusion services in Uttarakhand, blood component services like apheresis, NET tastings, regenerative medicine. Ma'am has established the first transfusion medicine department of Uttarakhand. Ma'am has numerous awards in her name, and the few are Best Teacher Award from Chief Minister in 2013, Best Teachers Award at AIIMS Rishikesh in 2021, Him Ratna Award from Governor of Uttarakhand in 2020, COVID Warrior Award in 2020 and 21. So, with the credence, with the introduction, now I would like to invite ma'am for the presentation, and we will be having this very, very important video presentations on interpersonal skills video. Also, that ma'am mentioned, Dr. Vandana Dhingra ma'am mentioned various factors associated with violence on healthcare workers.
Hello everyone.
So all the
I am
participants are
happy to discuss
requested
with
to ask
all
the questions. So here is the presentation. Thank you.
of you today about the role of interpersonal skills in medical curriculum. This is a topic which is often ignored or not discussed, and we realize later in our career that this is a very important attribute which is difficult to attain later. So here we would like the students to understand what it is. I would like to introduce you all and also tell you what is the importance of understanding and improving our interpersonal skills. So it is often faced by various medical professionals. They find that it is challenging to communicate effectively and efficiently in the workplace. And when communication is not good, then it leads to stress, anger, misunderstandings, and even disappointments. So considering that, I thought the things that I would discuss in this session today are: what are these interpersonal skills? Who are the people who need to learn them? What are the areas where they will be helpful? Also, is it possible to learn and assess these skills? So, continuing with the same topic, so there are many forms of interpersonal skills. It has a role in almost every area of life. But here, what we will discuss is the role in the first one, that is the professional relationships. So, essentially, the main interpersonal skills are effective communication skills, things like listening and expressing. And some new things that I would like to discuss today are assertive communication, the how to conduct a negotiation to get whatever you want, the ability to give and receive feedback, and then being able to work well in teams or groups. So, why we are focusing on communication today is that some very wise person has said that half the world is composed of people who have something to say but are not able to convey it, and the other half who have nothing to say but they are always saying it. So, it tells us that we need to find out which area we belong to. Now, everybody would have read and understood many times. There are many types of communication. The most important being verbal and non-verbal, and the most important one being non-verbal. So this non-verbal communication, the main attributes would be appearance, gestures, expressions, posture, eye contact, and so many more. So basically why I am talking about this today is that we sometimes think that what we have spoken is the main communication attribute that we have, and we forget about the other things which are far more important in how we are able to express what we want to say. Now, how can communication be improved? So interactive management, managing your superiors, your colleagues, everybody else. So a very interesting concept is that of management by wandering around. When you're wandering around the office, hospital, or any workplace, you meet so many people, and these are some kind of communication which helps without speaking, without expressing, but you meet so many people and you improve your skills. Regular employee group meetings are absolutely essential for any department or any organization to work properly. Now, if things are going bad, then communication consultants are there who their help can be sought. And then another thing which helps us in assessing what is happening is a 360-degree feedback, where feedback is taken from everyone from the top till even the lowermost level, even including the janitors. So it helps us to understand how we are able to communicate with people. Another big communication problem is that we do not listen to understand. Mostly people would be listening so that now their turn would come and they can speak even more. So people often do not realize that having a good listening ear is as important as speaking clearly or speaking properly. So some of the essential ways how you can improve your listening power is by active listening. Means the process of taking action to help someone say exactly what he or she really means. And here it is important to listen for what is the message content. Also listening for feelings which are not spoken but they are there. They are very much there. Noting all the verbal and non-verbal cues. So once listening is accompanied by speaking and including a little bit of thinking in between, it will help you in active listening. Now, I also want to introduce here another concept, which I would call the concept of assertiveness. So assertiveness is something which will allow people to speak their minds without hurting others and without without getting a feeling that you could not express what you wanted. So here people can even express their anger or disappointment but not getting aggressive. So on this scale I am showing you that the reactions wise people can be called passive, assertive, or aggressive. Passive being the persons who choose not to speak anything. They will just feel bad and say that I'm fine, everything is okay, but a lot starts getting built up, leading to poor interpersonal skills. Being aggressive, as always, being angry is not taken as a good sign. So the optimum balance is being assertive. So people who are assertive, they would stand up and argue for their rights, even if there is disagreement or conflict within the team. They would not feel anxious and they will deal with stressful situations calmly. Now, how to develop assertiveness? It is easier said than done. So, to begin with, one has to learn that assertiveness is an attribute which can be developed, and one needs to value their own needs and rights and ask for them to be satisfied. At the same time, if there is something that one doesn't agree with, then one should learn to say no when you need to. This is one of the essential keys to assertiveness. Now, giving feedback and accepting feedback are two very essential attributes of good, proper communication and interpersonal skills. So, as always, you should remember that when you are giving feedback, it should be positive, it should be specific, feedback should be non-judgmental, learn to be sensitive, the feedback should be given timely, and when you are following all these things, communicating well, taking care of taking care of listening skills, the teams get nurtured. It is not very easy to keep the groups going. So team dynamics are taken care of when teams are nurtured properly using all these phenomena. There are so many benefits of being in groups. You would find a lot of students prefer to do group studies. So here you can use the experience, skills and knowledge of others. You get support, encouragement, and even responsibilities shared. Work is shared. You understand each other's perspectives. Now, when people are in groups, there are bound to be conflicts. And this graph shows you on the extreme left, you will find a very low level of conflict. So this situation is also called a dysfunctional situation, where there is no conflict at all, and people are just accepting everything. They are not asserting. Even the wrong things would be accepted. On the right extreme, you would find another dysfunctional situation where there is too much conflict. Here people are not regarding each other. A lot of aggression is happening, yelling, a lot of rule breaking. However, so you would find these two are dysfunctional situations where productivity is minimal. However, if you look at the center, in the center of this graph, this is where the team's productivity is high, because there is some optimum amount of conflict and people are assertive, they cooperate with each other, they explore various options and they listen to each other. So this is the reason why, as a student, as a team worker, everyone needs to understand that conflicts are inevitable. They will always be there. One has to learn various methods of conflict management. Now, there are many scientific tools also. So one of them being this graph. This is called the conflict management style grid. So if you see here, there are two on the X and Y axis. There is the level of passiveness to aggressiveness. On the other axis, you will find being cooperative and being uncooperative. It's a very useful tool. And if you see on the extreme left and upper side, you will find when people are very aggressive but not willing to cooperate. So this is called conflict management by the style of a shark. People are competing. So one party wins, the other party loses. The second one, when there is passive role and people are not cooperating, it is the style of avoiding. And accommodating is when people are just thinking of cooperation but they're not worried about the task. So teddy bear style. Collaboration style is that of the owl, the wise old owl, where people are assertive, they talk about differences and they try to find solutions and cooperate with each other. Another optimum style is style of the fox, which is called compromise. Here people would compromise on the productivity and also they would cooperate, but optimally, not fully. The best style is the style of the wise old owl, the collaborating style, and there are various techniques how conflict can be managed. Now, sometimes there are situations where conflict is not being managed, so one would like to have a negotiation, a win-win situation for all. So this is where both the parties decide to make joint decisions because the preferences are different. This situation is always susceptible to conflicts. So one needs to have very good communication and interpersonal skills to be able to negotiate. So other approaches when negotiation fails totally are using mediation through somebody else, through a senior HOD or a senior person, or arbitration, a neutral third party who will help both the parties reach an amicable solution. Major challenges why all these situations happen when it is when we talk about interpersonal skills are failure to recognize non-verbal signals. For example, as in the ones that I mentioned earlier, like gestures, facial expressions, people don't understand and they're just going by words. Also the growing use of communication technologies, so people are just talking over emails, the real feelings are not being conveyed, and there are resulting in misunderstandings. So these are common reasons why interpersonal behavior and interpersonal cooperation does not happen. There may be physical distractions like telephone calls in between, visitors, lack of privacy. These are all the various things which lead to all these problems of interpersonal communication. And when all this is done well, things are so good. Many over 2500 years ago, Sun Tzu wrote, "Regard your soldiers as your children, and they will follow you into the deepest valleys. Look on them as your own beloved sons. They will even stand by you, even unto death." So this is actually an ideal situation. Now, who needs to learn all these skills? So I would say in the medical community, in the OPD, in the ward situation, or when you are organizing a conference or any other situation, practically everybody needs to learn interpersonal skills. It is not that it's only for the students to be using good interpersonal skills. Everybody in the medical team needs to know how to have good intercommunication skills. And what I'm saying is not just by experience or anything, it is by evidence. So there are so many papers which say that clinical tasks assigned to residents will not allow students to learn the role of leadership. Another publication is saying that these soft skill roles are less than 20% of the clinical activities, and later on we find that the percentage of contribution of interpersonal skills is almost 50%, if not more. And these skills are scarcely observed. They are not routinely taught in many Indian medical undergraduate or even postgraduate courses, which is why here I am insisting that communication skills and interpersonal skills go hand in hand, and they are essential to teach and assess. Even the NMC curriculum will repeatedly say, while it is talking about the academic points, it also talks about a lot of this interpersonal skills. They will talk about leadership skills. So in almost all branches it is needed. There are some special situations. I'm just mentioning them here: breaking bad news, announcing about malignancy, handling aggressive family members, colleagues, admitting your own mistakes. Sometimes the employees are over. There are so many situations where good interpersonal skills and communication skills really help in your medical skills as well. So who has to plan these sessions? So mostly in the departments, the heads in charges, dean of the institute, management, and even state and national agencies need to plan these sessions and make them mandatory. Who would be teaching in these sessions? People who are trained, experienced peoples. Online sessions are not as effective for these topics, as I said before also, but if there is a scarcity of trained people, online sessions could be conducted like we are doing now. So students would develop interpersonal skills by observing their seniors, teachers, mentors. So they would take people as their role models. And there are so many things which will help in teaching these things, like videos, role plays, group discussions, focus groups. So there's another publication, an Indian publication, which is saying that communication skill training courses should be mandatory for undergraduate and postgraduate students. Short workshops focusing on how to listen effectively, how to allow patients to vent their frustration, encountering various barriers of communication are essential. So they are recommending that there should be a training course at least over 3 days or more to enable all topics to be covered properly. Assessment, though it is slightly difficult and tricky for these kind of topics, but it is possible through feedbacks, complaints, direct observation by peers, specific feedback, like I mentioned in the beginning, 360 degrees feedback. So all this is essential to be followed by training. So as I said, assessment of soft skills and attitudes demands a subjective approach. It cannot be done through MCQs or written tests. So there are numerous tools available even to assess these skills. So finally, I would like to summarize by saying that it is essential for all students to attend teaching learning sessions and even assessment and feedback sessions on these essential effective communication skills like listening, assertive communication, negotiation, being able to give feedback and also receive feedback, and also teamwork and dynamics. So these are some of the reference that I have used. And finally, I would like to thank you for patient learning.
Everyone for the patience listening, and this now this comes to end to the presentations we had today. Three wonderful presentations on extremely relevant topics, and now the house is open for the discussion. We have two sessions, so we can see Dr. Geeta Negi ma'am and Dr. Vandana Dhingra is also with us. I could see her also. So, ma'am, there are two questions, Geeta Negi ma'am. One question was asked at YouTube on YouTube that very important topics. Just a query if these topics are included in UG or PG curriculum from NMC or AIMS. Yeah.
Yes, they are there. If you see the NMC talking about undergraduates, they talk about some essential roles that every Indian medical graduate should have. So some of those roles include the Indian medical graduate is expected to be a good communicator, a good leader. So it is there. And for post graduation, I can tell you about my subject, transfusion medicine. So there are so many competencies which talk about having good communication skills and a good knowledge of interpersonal skills as well. Yeah, they are there in the curriculum.
Thank you, ma'am. Ma'am, there is another question that I would like to ask from Vandana ma'am. Yeah, any meta-analysis on various factors protecting violence against healthcare workers? Yeah, ma'am. Any meta-analysis that mentions like these are the factors which through which we can protect our healthcare workers?
Hello, Dr. Umesh. Thank you for the question. I'm not aware. I can just look it up, or maybe we can look it up and get back to you on this in one of the other sessions. So, of course, I think there are a lot of articles on violence against doctors all over the world, and I'm sure there would be many, but I'm not very much sure about the details of these. This I just slipped in actually because I realized that my topic was talking a lot about being nice with the patient, being gentle with the patient. So this is a whole topic. It requires an entire session, handling violence, because the surgical branches and a lot of areas where you really need to specifically address this. So we can have a dedicated session on this. I think that would be more appropriate.
Right, ma'am. Ma'am, I had a question. Like even I had a doubt. I had a query. Like these topics were included by National Academy of Medical Sciences in view to decrease the to increase the awareness among the clinicians, among the students, and this will definitely decrease the violence if we have better communication with the patients. We have more empathy with the patients, and we have better interpersonal skills at the workplace. So yeah, ma'am. So like what we think that, ma'am, is the most important message to our students. The majority of the participants are postgraduate students. So which is the area that they should focus most? That I would like to ask, ma'am.
So honestly, these are things which have been ignored. The ignorance is not mandatorily; it was thought of to be in the as a hidden curriculum. So people were assuming that students would directly learn about communication skills, empathy, and all these things. But then later, NMC and all the senior teachers, they woke up to the fact that students are different, the teachers are different, the circumstances are different nowadays. So we need to actually teach these things to the students. But since, as I said earlier, all this was considered as a hidden curriculum, we were never taught all these things. But nowadays scenarios are different, so very few people have started doing these sessions. Like, you have taken a good step by taking all these three topics together as a major thing for the postgraduates. So very few in very few places these sessions would be found. But the students have to understand that these are important things wherever they get a chance. There are some institutes which regularly do these sessions. Some colleges have started having a department of medical humanities. So wherever they come across this kind of things, they should not think that to pass the exams knowledge is essential, why to go for these things, this is natural. So these things are definitely needed. You will realize later on, once you become full-fledged doctors, there is no scope to learn all these abstract things which are far more important than knowledge. Knowledge is also important, but these, so never lose a chance to learn these topics. Wherever you get a chance, try to get into them. That is
Yeah,
my
yeah,
message for the
yeah,
students.
this is very, very important. There is no age limit, no educational limit to learn.
Absolutely.
Yeah, thank you. Thank you. Vandana ma'am, do you want to add something? Yeah.
Yeah, I would like to add that what Dr. Geeta said, that ma'am is the co-chair of the Medical Humanities Department at AIIMS Rishikesh, and I am in her team. And with ma'am, I have myself also experienced a lot of changes or improvements in our own professional. Even as consultants, we do not have the exposure. So the you students are getting this exposure at this level. I think it's a very good thing. And what ma'am is saying is right, that we are learning through our experiences. But if you learn this in a formal way, it will not only benefit you in your professional career, it will also benefit you in your interpersonal relationships, in your entire quality of your life. And you will be definitely more productive and more happier. And it will really change your perspective. So this is not something you can just dismiss ke nahi isse kya farak padta hai. All these three areas are very relevant for all aspects of your life. So please take it in that way, and try to incorporate a lot of these things. If the PPTs are available online, so just try to incorporate a lot of things in your daily work.
Thank you. Thank you very much, ma'am. Thanks a lot for these wonderful presentations and very, very important in today's era. So with this, I would like to invite Professor Ajay Kumar Sood, sir, for the vote of thanks. Sir, please, over to you.
Thank you so much, Dr. Jaswant. It is indeed my great pleasure to thank the distinct speakers for this evening. All the three speakers, we are really grateful to you, Professor Huda, Professor Geeta, and also Professor Vandana, for being with us this evening. Very interesting topic, which is very much relevant to not only the student, for all of us who are whether working in a hospital setting or in a other setting as well. And you very rightly said that in order to be a successful professional, we require two types of skill, as Dr. Geeta also mentioned. One is the soft skills, which include communication, empathy, and interpersonal communication. And second part is the professional skills. So the optimal combination of these two skills are very, very important for practitioners as well as for managers. So thank you so much for taking time and giving us this opportunity to learn from you. I'm sure that our participants have greatly benefited from this session. So thank you so much, and we look forward for your support in future also. So I will also like to place on record the support which we have got from the director, AIIMS Rishikesh, Professor Meenu Singh Madam, and it was under her guidance that we could have access to you, and we have a wonderful session. I will also like to place on record the support for coordinating this session which we have got from Dr. Bhavna Gupta ma'am, and thank you, Madam Gupta, for communicating with us and arranging all these things. We are really grateful to you. So I will also like to thank all the director, deans, faculty member of AIIMS who have helped us and encouraged the medical students to join this program. And we are really happy that we have more than 1,000 registrations with us. And again, I want to make appeal to all faculty members that please, this is your program, and you please join us and tell us about the topics which you like to cover in future. So thank you once again. Participants, again, we are really grateful to you for making this session interactive by putting questions. And in future also, we look forward for your support. Tell your friends that this session will be useful to you. The list of this we have already circulated to the registered students. We'll again send you the details. The next session is due on 1st of December. And there again, we are going to cover a very interesting area of how we can collect samples from the wards or various specimens, and what are the actually the practical aspects of hematology, pathology, and biochemistry. So this session is again going to be taken by a distinguished faculty member from all over the AIIMS and the country, and that will help you in understanding these things a little bit more clear. So I will also like to thank the moderator for this evening, Dr. Jaswant from AIIMS New Delhi. He has been helping us from the very beginning. So thank you so much for being with us. So in the end, I will also like to thank our IT person who has arranged all these things. And I apologize for some glitches which he had in the session because of some IT technical aspects. So once again, I thank you all for joining and look forward for your support in future also. Thank you very much. Over to you.
So thank you, sir, for the kind words. So with this, we end this session. And again, thanks to all the speakers, eminent speakers, and the participants. Thank you, everyone.